We might say hormones are the new wellness buzzword. But while Instagram offers smoothie recipes and TikTok delivers 90-second diagnosis, most women don't even know where to begin. Is it normal to feel completely drained in your early 30s? And could the pill you've been on since you were 16 be sabotaging your body? Is a perimenopause actually a thing? And if so, when does it actually start and why doesn't anybody talk about it? This is not an episode for women in menopause. This is for women who refuse to have their questions around women's health dismissed, whether they're navigating their first hormonal shifts or confronting changes they were never warned about. Welcome to the Noella Effect. Dr. Jillian Goddard is an endocrinologist, an assistant professor at NYU Grossman School of Medicine, the author of The Hormone Loop that is upcoming, and the voice behind Hot Flash, a powerhouse newsletter on women's hormonal health. With over 15 years of clinical experience, she specializes in decoding the hormonal shifts that affect women from puberty to pregnancy to perimenopause. And she does it with rare clarity, zero BS, and a fierce commitment to the facts. Jillian, it's a pleasure to have you on.
Thank you so much for having me.
So, Jillian, you're an endocrinologist, which means you're also a translator. Because let's be honest, most women and humans for that matter don't speak hormone. So, what are the most common ways that the body starts whispering something is off and women just, ignore it until it literally screams?
Yeah, so I think that the biggest thing that so many of our hormones can do is affect our energy levels and our sleep. And of course, then if you're not sleeping well and you're having low energy, not sleeping is only going to make things worse. And I think those are sort of the early things that women don't always pay a lot of attention to, or they make excuses. They try to write it off. I'm busy. I have a job. I have young kids. It's my bed partner snores. Like, we make all kinds of excuses for why we're not feeling our best.
So bloating, exhaustion, the mood swings. I mean, we all tend to kind of normalize it. I'm 33, soon to be 34 in December. So we normalize all of this. And I, for example, live a pretty, I'd say pretty healthy lifestyle. I do cheat sometimes, but I tend to
We all
move.
do.
I tend to exercise. But still, there's these days then just today has actually been one of those days. And since I'm a night owl, it's 9 p.m. right now. And, I'm just starting to wake up because, yes, I've normalized that for myself, having low energy, low, motivation in the morning because I've just normalized it. I just don't work well in the morning. So I accepted the night owl paradigm, I guess. But is that actually a thing? You can tell me now as a doctor. I'm certain you know more about this than I do. Is this a thing from the caveman? Like, we're programmed from the first day, like you and you are going to, take charge of the morning, and not everybody can be asleep at the same time because it's, it can pose a threat. Is that actually a thing that we're actually programmed in a certain way?
It's a very real thing. Mm. Both our circadian rhythms, when we like to go to sleep, when we like to wake up, when we feel the most energetic or alert or focused, definitely varies from person to person. And I usually say, the best way to go about it is just to do your best to work with it, because it's really difficult to change. It's really hard to change whether you're a night owl or a morning person, a lark, as they say. The one thing that does happen is, and this is also very real, is that when we go through puberty, everybody shifts to be more of a night owl than they were as a child.
Mm-hmm.
Um, and then people do tend to shift back a little bit, although we don't usually, go back to our
Factory
elementary
setting.
school. Yeah. We don't usually go back to our elementary school sleeping from 8 to 6, but we tend to be we are all our most night owl we will ever be in our teens and early 20s, and then many of us start to shift back a little bit in our late 20s and 30s, to a little bit more of a alert in the daytime sort of situation. But there's not a lot you can do to change when those energy levels are high and low, and it has to do with your particular body's secretion of cortisol. Actually, cortisol levels are highest when we get up. Whenever that happens to be, it's those high cortisol levels that wake us up and get us out of bed. We all tend to have a midday slump, so that time after lunch that many of us experience, we tend to be lowest energy. I mean, think about it. Cultures across the world have come up with ways for dealing with this, from siesta to high tea to the French have goûter and the Swedish have fika. So we've all come up with ways, whether it's to fight it with caffeine and sugar or to give into it and to take a nap, that like midday slump is real. And then our cortisol levels go up a little bit again in the evening. We get a second wind, and then they're lowest right before we go to bed at night.
Yeah, when melatonin kicks in, right?
Yes, that's exactly right.
Yeah, I heard. I saw actually this. I saw this meme a while ago, and I've only tried melatonin maybe a few times. I don't really have problems sleeping. I just wanted to, test it out.
Yeah.
And actually, it's not that good if you're prone to bad dreams, because
Mm-hmm.
this meme that I mentioned said, "Oh, it's melatonin and my sleep paralysis demon." So, taking it synthetically might not be the best idea, guys.
Some people do have vivid dreams from it. Yeah.
Yeah. I mean, I wanted to ask you also about when you mention exhaustion. A lot of women, because this episode is guys, the males, I'm sorry, but you should also know this, but this episode is mostly going to be centered around women. So, busy women syndrome and pushing through. How do you comment that?
Oh my gosh. It's so hard because our lives are typically not set up to follow the ebbs and flows of our energy levels. Many of us have big changes in energy levels, with our menstrual cycles. And modern life is just not set up for you to take 4 days before you get your period and like lay low and take a nap. I think, there's a couple things I always recommend. One is making sure that you're prioritizing sleep all the time and not just when you've kind of pushed yourself to the limit and can't go anymore, I think is really important. Everyone can benefit from prioritizing sleep, but I think women especially can benefit from making sure you're really getting what your body needs, from a sleep perspective. And that can be, on average, that's anywhere from 7 to 9 hours. But that's a big window. Some people only need 7 hours. Some people really do need 9 or 10 hours to feel rested. And to some degree, that's also not something that you can change. And then prioritizing exercise, moving our bodies has a huge impact on our energy levels and our moods, and the way in which we perceive the different things that we feel in our bodies. And so prioritizing exercise is also really important. So if you're sleeping and you're exercising, it's a lot easier to deal with those natural ups and downs in energy level.
Yeah, I mean, even for the busy women, because when somebody, I ride a bike. I'm a
Mhm.
huge fan of the bike riding. But for some women, they are so busy and so consumed with their daily schedules that they cannot even find the time. Like, oh my God, here is another one telling me I need to exercise.
Yeah.
But you know, these things add up. So I like to say when it's go, you know, take a walk. And if you don't even have time for that, if you work at all, if you're not running around your kids all day, because that's also exercise by itself, but if you're not doing that, you probably have a car parked a bit further and just, you know, walk. Even that counts for something, because if
Hmm.
you're working 5 days a week, that's 5 days of 10-minute walks. That's 50 minutes if I'm not mistaken. You said also that a lot of people say that doctors sometimes aren't trained to read between the lines when it comes to hormones. What is one thing that, to you, women often complain and that just gets completely misread or ignored in a, you know, typical 10-minute appointment they get to?
Yeah, I mean, I do think it's that fatigue again that women complain
Mhm.
of, that doctors often, they don't know how to think through it. They haven't, it takes time. Fatigue is a very vague symptom. It could be due to vitamin deficiencies, hormone fluctuations, anemia. You know, there's a million things that could cause fatigue. And so I think it feels overwhelming even to doctors to start to chip away at what might be causing that. And so there tends to be a lot of shoulder shrugging and, oh, well, you know, you are, I don't know, put the age in, right? Like you are in your 30s
Mm.
now, you are in your 40s now. I feel like that starts when you turn like 25. And, but really,
Mhm.
oftentimes it can be pretty simple to do a little bit of blood work, look for common things, and find things that really do, that can be easily addressed, that really do help women to feel better. So,
Mm.
I would say push back when someone says, "Oh, well, you are whatever age you are during that
Yeah.
particular visit," because um, if you're there at the doctor complaining that you're tired, like that should be taken seriously.
Yeah, because it's kind of wild to think that, you know, what you walk out of a clinic with a clean bill of health and you still feel like crap
Yeah.
on the inside. What do you look at in blood work
Yeah.
that makes you
Um,
say, you know, something is off?
yeah, you know, it's really interesting because I mean, I see a skewed view of the world because I see people who are coming to an endocrinologist, and I do mostly see women. But a lot of times they come because they think there might be something wrong with their thyroid, and that is definitely a possibility. And I do
Mhm.
always check for that. Um, it's, you know, I was talking to someone recently and they were like, it seems like everybody has something wrong with their thyroid. And I said, well, you know,
Mhm.
5% of the population has a thyroid problem, but women have thyroid problems 5 to 8 times more than men do. And then, so that means that by the time women are in their 40s, it's approaching, you know, 8 or 9% of women. And by the time women are in their 60s, like 20% of women have a thyroid issue. So it really is
Mhm.
very common. And so it's worth looking for and addressing, because it is a common source of fatigue. Anemia is really simple. So low blood counts, not having enough oxygen carrying capacity in your blood, really is really common among women in their reproductive years, because you losing blood every month in a menstrual period, and if you're not getting enough nutrients to make that up, or if your periods are very very heavy, it's easy to become anemic and not catch up. Along with that, a lot of young women are iron deficient. B12 deficient. These are all things that can really impact energy levels and overall sense of well-being, and can be, relatively easily fixed. You just have to look for them.
If you had to design a hormone education class, we have sex ed, we don't really get hormone ad. So I feel quite often that this lack of literacy costs us and women and men and women actually years of misdiagnosis, shame, and unnecessary suffering. If you could do one hormone education class for women, say in their 20s and 30s, what lesson would be number one?
I think that just understanding the way hormones work would be lesson number one. And this is a lovely seg to my forthcoming book, because this is exactly what it's about, which is people don't understand what hormones are or how they work. And what they really are is a series of feedback loops. And when something goes wrong, it's because the feedback loop gets out of balance. And so understanding what those main feedback loops are, what the hormone loop really is, and what the different components of it are, and what those things do is really critical for women to advocate for themselves. In the United States, there's only 9,000 practicing endocrinologists, and there's 168 million women, and that's just in the US. In other countries, the stats are even more skewed, with very few hormone specialists available for women. So it's really important to just understand what the endocrine system is, in order to start advocating for yourself.
I'm going to go into some controversy and some clarity as well, what no one else will say. You support FDA approved hormone therapy, but in all honesty, many women are walking away from synthetic hormones completely, if they were ever on it at all. Are they just rebels without a cause, or are they seeing something that medicine still refuses to see?
I actually think that they are working with old information, with old, out of date information, and with stereotypes about off the shelf FDA approved hormone therapy that have long since been debunked. So in the early 2000s, a study called the Women's Health Initiative study came out. It was a huge study paid for by a big pharmaceutical company, looking at hormone replacement therapy as a way of preventing heart disease and osteoporosis in menopausal women. So these were older women who were already in menopause. They weren't necessarily symptomatic, but they wanted to see if the goal was to prevent heart disease and osteoporosis. That study was ended early because heart disease rates were actually increased, and there was a very small increased risk of breast cancer in the group that got hormone therapy. But I think it's really important to know a couple of things about that study. One is the women in the study were older. The average age was in the late 60s or early 70s. These were not women in their perimenopausal years. These were women, well past their last menstrual period. Two, and I think this is even more important, is the formulation of hormones they were using. In this study, they were using a product called Prempro. Prempro was a combination hormone replacement pill that contained a particular type of progesterone called medroxyprogesterone and a particular type of estrogen called conjugated equine estrogens. And that estrogen is isolated from the urine of pregnant horses. And it is not the same as the estrogen that our bodies make. And the medroxyprogesterone is not the same as the progesterone that our bodies make. After that, there was this big interest in what have been called bioidentical hormones. Mm-hmm. And there's a lot of confusion about exactly what those hormones are. Technically, a bioidentical hormone is just a hormone that is exactly the same molecule as the hormone that our body makes. But when we talk colloquially about these bioidentical hormones, they were typically creams that were made in compounding pharmacies. They're definitely still available. And the quality, while the hormones that they use are identical to the hormones that our bodies make, the quality control is not the same as a product that you get off the shelf. In different locations, compounding pharmacies are regulated in different ways. Since then, one of the things that has happened is we now have bioidentical estrogen and progesterone that's FDA approved that you can buy off the shelf. So most estrogen patches, the estrogen gel that's marketed under the name Divigel, those are bioidentical estrogens. They are exactly the same as the estrogen our ovaries make. And there is progesterone that's identical to the progesterone that our ovaries make that you can take as a capsule. And so some of the concerns related to the type of estrogen and progesterone in the aftermath of that Women's Health Initiative study, those issues are resolved. And in fact, the products that are approved by the FDA have much more rigorous study and data behind them than any natural product out there. Most of the studies of plant-based phytoestrogens or isoflavones, all the things that are in over-the-counter supplements are those studies are very short. We now have years and years of data of women taking, estradiol via patch or cream or even pill, but the more bioidentical version of those. And we have reams more data on that than we do have on supplements or bioidenticals made in a compounding pharmacy. And so I think that a lot of this came out of, an understandable concern based on a big study, but the information hasn't gotten out there that what people are getting now from their, CVS or Walgreens or their corner drugstore is not what was being used in the Women's Health Initiative. It's a different type of estrogen altogether. And in fact, it is isolated from plants actually the same way that a lot of the supplements are. So, and it's covered by insurance.
Yeah. Let's talk about the pill, because where I live and generally in Europe, it's not as common for women to be, I don't know, on the pill for 10, 15, even more years. So let's say if a woman's been on it for, let's say, a median of 15 years straight, what are the doctors possibly not telling her about what that does to her body and her natural hormone cycle? Let's say that she didn't really have any issues or any imbalances to start with from the beginning.
Yeah. So I think the key is to understand exactly how birth control pills work. They are a combination of estrogen and a progestin, which is a synthetic progesterone, that you take in a pill, and it prevents your pituitary from making the hormones that tell your ovaries to ovulate. And it does that because it acts as though your body is making estrogen and progesterone, but really you're taking it in a pill. So the pituitary gland thinks there's enough estrogen and progesterone around. I don't need to make those hormones. And so what happens then is you don't ovulate, which is effective contraception. And in some cases, in some medical cases, it can be very helpful. So what that means is that when you have a withdrawal bleed, it's not really a period. So you take the active pills usually for 21 or 24 days, and then you take a placebo pill or a sugar pill. And during the time that you're taking that placebo pill, you get a bleeding. It's not really a period. It wasn't driven by ovulation and a lack of pregnancy. It's really just the withdrawal of the hormones that you were taking. And so your period regularity on a pill doesn't really tell you anything about what your natural cycle is doing. There can be pluses and minuses to that. The biggest minus to my mind is that when people go off of it, especially if you've been on for an extended period of time, when people go off the pill, it can take quite some time for your periods to come back. And the longer you've been on the pill, the more suppressed your pituitary gland is, and the longer it will take for your period to come back. And I think that just leads to a lot of worry and stress. And, if the reason someone's going off the pill is because they are hoping to become pregnant, it can delay their plans. And so I think that is one of the things that can be very limiting about it. The other thing, the data is very mixed. And when you look at a large group of women, you don't see any increased risk of breast cancer. You maybe in some studies, there's a small increased risk of breast cancer with birth control pills. Usually that is in people who have other risk factors for breast cancer, but that is something that you want to be aware of. Conversely, there are some positive things about taking the pill for an extended period of time. One of them is that it has been shown to reduce your risk of ovarian cancer. And so if someone is particularly at a high risk of ovarian cancer, there may be some benefit there. And it does possibly prolong fertility and delay menopause. And it's not like you take the pill for 10 years and then your fertility lasts 10 years longer and you have menopause 10 years later. It's not that like tit for tat. But it does seem like women who take birth control pills for longer periods of time may experience menopause later and as a result be fertile for longer into their 40s. So there's pluses and minuses, and I would argue with all medications, there's pluses and minuses. And so you just want to be really clear on, the risks and the benefits and how that balance feels to you.
Yeah, listening to your body is incredibly, incredibly important.
Yeah.
I pride myself that I know exactly what my body is doing. How is it feeling? I'm a spiritual person, so I see my body as a vehicle. So same as my car in a way. I look at it, okay, what is it doing now? I know when this is happening, when this is happening. Why am I feeling like this? I have to investigate. So, I wanted to touch upon a very important subject as well, and that is food. Food is
Mm.
incredibly important and highly correlated to
Yes.
how our hormones and entire bodies work. Same way that I feel like crap when I eat like crap. That's a tit for tat. So here's also something personal. Ketogenic diet, changed my life. I'm allergic to wheat of all things, and I only discovered that in my early 20s. So naturally, I had to find a way to, my body was in a constant inflammation state for years, and their theories, I was born a bit premature, and they were theories that all allergies I had, nobody could have figured out what I was allergic to when I was a kid. That perhaps I always had it. I always had this allergy, and only discovered it in from a blood test, expensive blood test that I did in my 20s. So keto, after I, went very deep into it, I like to experiment as well with, diets and such. Um, Turns out it erased some of those autoimmune issues, not the allergy. That's very much persistent. I literally cannot touch the wheat bread, but other things that I struggled with when I was in my 20s. Now in my 30s, I can say, and knock on wood, I feel better than I felt in my 20s because I practice from time to time, not all the time, ketogenic diet. So a lot of doctors would roll their eyes on me, but some of them don't. What do you think about keto? And is it as a similar metabolic diet for hormonal balance?
Yeah, I mean, I think that people forget that the things in our body that help us metabolize our food are also in many cases hormones. And when you're talking about carbohydrates, you are talking about insulin.
Mm.
And so every time we eat, we all have a little insulin around all the time, but every time we eat something that contains carbohydrates, our pancreas makes insulin. And that insulin allows our muscles to take up the carbohydrate, and it allows our fat to store extra carbohydrate to use it later. Um, and so what's happening is our blood sugars are rising and falling over the course of the day. And our insulin levels are rising and falling over the course of the day. We now know that some people's insulin level response, the way their bodies respond when they consume carbohydrates, is much more dramatic than others. So some people their bodies have this outsized response to consuming carbohydrates. They make lots of insulin. And what that means is they end up on this roller coaster where their blood sugar levels are rising and falling. They're going super high, they're dropping super low. And that in and of itself feels terrible. Most people don't feel good when their blood sugars are rising and falling. They feel okay when they're rising. They feel terrible when they're falling. And so then they consume more carbs, and then their blood sugar goes back up. They feel better. Then it starts to fall. They feel terrible again. I've had patients who were like waking up in the middle of the night feeling terrible, and they couldn't figure out why. And it turns out it was probably blood sugar related. And so that's one piece of things. But insulin is a hormone that doesn't just affect how our body manages carbohydrates. It has effects in our hypothalamus, which is the part of our brain that controls a lot of our other hormonal responses. And it has effects on our ovaries, actually.
Hmm.
So when insulin levels are high, um, that can impact ovulation, and as a result can impact all of our other reproductive hormone levels. And that piece of how of insulin impacting the ovaries is something that we have not really understood for a long time, and is probably the sort of the linchpin for understanding polycystic ovary syndrome, where you have women who can be very insulin resistant and don't ovulate when their insulin, when their insulin levels are so high so often. So keto, you're limiting your carbs very, very significantly, usually to less than 50 or even less than 20 grams a day, depending on what kind of, exactly what diet you're following. And so you are not spiking your insulin or your blood sugar levels at all. And so those lower levels of insulin can definitely have impacts on your other hormones. And the sugar in our blood, although we need some, sugar has been shown to sort of cause inflammation and damage kind of all over the place. We think that the effects of sugar in the brain may have a lot to do with how people age. And so the more we understand about insulin and sugar, the more it seems like having lower sugar levels and lower insulin levels is probably better for most people. And one way to accomplish that is a keto diet. So my only objection to a keto diet for most people is that they can't maintain it for long periods of time, because it's can be very restrictive, and then they undo any positive things that they did by like going way off the deep end in the other direction when they stop it. And so you can see how that being super restrictive and then, going crazy could be counterproductive to your goals. And so that's my only beef with it, honestly.
Yeah, it can get pretty restrictive, but honestly, it took me a while, getting on and off, because it gets my biggest beef with keto is it's boring. It's
Yes,
so
it can be very boring.
very boring. But a good thing is, if you have even the smallest amount of creativity, you can start. There are a lot of YouTube videos and recipes online. You can think of even yourself. You can think of all these things that you can do with eggs, because I've
Mm-hmm.
seen that even carnivore diet is getting a lot of traction as well as a therapeutic. And usually the way I do it is that I go maybe 2 or 3 days carnivore, just the eggs and the meats, and only after that I go on the zucchinis and all these keto friendly things. I go maybe 2 3 weeks until I get super bored of it, and then you know the rest. But but I don't swing anymore to this other extreme, because I know this is a cycle, and I gently push myself from keto to conventional diet,
Yeah.
including gluten-free pasta and everything else. But I know that another time will come and I'll have to suffer the consequences. So I try not to overindulge. So balance
Yeah.
is kind of key here.
Yeah.
Uh, but speaking of diets, you also champion resistance training for
Mm-hmm.
hormonal resilience. But what about mindfulness, meditation, breath work? Can you calm your endocrine system as much as in stillness as in motion?
That's a great question. I think that there's a growing literature on this. But what I would say is, you know, we don't have a ton of data yet, but the first thing that comes to mind is anytime we do things like mindfulness, meditation, breath work, we are doing things that are turning down our stress levels and turning down cortisol levels. Um, And that can have real benefits. For sure. It can, I mean, I think there's lots of literature showing that mindfulness, meditation really are beneficial to people on lots of different levels, where we don't maybe have all of the biochemistry worked out is exactly what hormones are going up and what hormones are going down. But certainly cortisol levels are going down. And I think that there is definitely something to that. The other thing that I think is really interesting is that there's a lot of literature on cognitive behavioral therapy, which is a very specific type of talk therapy that is not directly mindfulness, but it is a sort of reframing or reconsidering our perception of something in our life. And there's data that shows that it can help with like hormone related mood changes, hormone related sleep disruptions. And I think it's this same idea where when you take a step back, take yourself sort of out of the throes of the, the like environment and like come back to like how you're feeling, what you're really feeling, identifying what's going on, you then in some ways you deflate the problem a little bit, and can come at it a little bit more effectively. So there's actually a good deal of positive literature on that. And so there's even some data showing, and I this isn't my go-to, but there's even some data showing that mindfulness practices and cognitive behavioral therapy may be helpful for like hot flushes and night sweats. They're not anything like taking some estrogen, so it's not a replacement for that, but it does have an impact.
Quite recently, I saw a video somewhere, I don't remember where, that said that perimenopause is, I'm nowhere near it, so it's understandable. I don't really know a lot about it. But this video said that perimenopause is not actually a thing. You're either in menopause or you're not. Is there any weight to that?
No.
Okay.
Perimenopause. But I do think that this is an area that really confuses people a lot, and it leads to a lot of miscommunication among women, but also between women and their doctors. So all these things actually have technical definitions. They're very well defined. A group of experts got together about 10 years ago, and maybe even more now, and really looked at all the data around the menopausal transition, and defined all of these terms. So one of the big confusing things is that there is this time period that's sort of a bridge between your peak reproductive years and perimenopause. And it's called the late reproductive stage. And one of the things that's confusing is women do start to see some changes and sometimes some symptoms that are associated with perimenopause. But they go to their doctor and they tell their doctor this, and their doctor says, "Are your periods regular?" And they're like, "Yeah, my periods are regular." And their doctor's like, "Well, then it's not perimenopause," which is technically true, but doesn't help people understand what's happening with them. And so there's that initial stage. That stage is when you still have plenty of eggs to ovulate every single month, but it takes more stimulation, and your hormone levels, especially your estrogen levels, can rise higher and drop lower at various times in your cycle. So they're still rising and falling like they've been doing since puberty, but they're rising higher when they're high and they're dropping lower when they're low, and that's why women are feeling symptomatic. So that's the late reproductive stage, and that happens in most women. It happens between the ages of 40 and 45. Occasionally, some women will experience it in their late 30s, but the vast majority of women experience it in their 40s. What makes it perimenopause? You're in perimenopause when your periods start to become irregular. When your periods are irregular, but they're still coming fairly frequently, that's early perimenopause. So if you have, and when we talk about irregular, we're always talking about cycle length. So if you have like a 24-day cycle followed by a 45-day cycle followed by a 32-day cycle, that's early perimenopause. Late perimenopause means you're going more than 60 days without a period. And that usually indicates that you'll have your last period in the next 1 to 3 years. The average age of menopause is 52, which I think is a lot later than people think. So perimenopause is really a phenomenon of the later 40s and early 50s typically, although there are outliers in both directions, of course. And then menopause starts, well, you don't know when you had your last menstrual period until you're already past it, right? It's not any different than any of the ones that came before it necessarily. But menopause, we say you're in menopause when you've gone 12 months without having a period. Women can be symptomatic at any time. So I just said the late reproductive stage can start in your late 30s or early 40s. Most women have their last period in their early to mid 50s, and you can have symptoms for usually 3 to 5 years afterwards, but you can also have symptoms during all of that time leading up. And so we're talking about a 15-year time span.
That's a long time. That's a long time to be having, the hot flashes and everything that goes with it. Speaking of hot flashes, guys, don't forget to subscribe to the newsletter. It's called Hot Flash. But other than that, there's a question that kind of bugged me for a while. If somebody, let's say, from very much the first day of her period, if a girl has a shorter cycle, let's say 23, 24 days, compared to a girl that has, or a woman that has cycle of maybe 32 days, that's also considered normal, but it's always, 31, 32, it's regular. Is the first one going to reach menopause earlier than the second one?
That is a great question, and it's one we don't really know the answer to. And that is because there's so many other factors that come into play. So, what you're getting at, of course, is that girls are born with all the eggs they're ever going to have. And menopause occurs when they don't have any eggs that can be ovulated anymore. So, one of the things that I think is tricky to think about here is that, and one of the things I think most people don't realize is that when you start the process of maturing an egg, there's not just one egg that starts down that road. Usually it's something in the neighborhood of 50 little follicles kind of start down the path toward becoming a mature egg. But as the month progresses, only one of them gets to the point where it gets ovulated, or occasionally two, but usually one. But that total number of eggs, those ones that don't get ovulated, like they're done too. So and not everyone starts maturing the same number of eggs every month. The biggest factor that the biggest thing that can tell you about like when you'll have menopause is genetics. But even that's not as straightforward as it seems like it should be, because you get genes from your mom and your dad. Your dad obviously doesn't go through menopause, but his mother did, and he may have sisters that did. It's just not always easy to get information from all of those people that's accurate. I mean, when I asked my grandmother about menopause, she was like, it was a big non-event. She couldn't believe anyone even like thought about it. That's the type of person she was.
That's really chill. Like,
Yeah,
okay,
yeah. Well, she lived to be
that's
99, so maybe she was onto something, but
nice, nice.
and so, and then smoking affects when you go
Mm.
through menopause. It causes earlier menopause. Um, having having certain types of surgery on your ovaries can affect when you go through perimenopause. So there's all these other factors that come into play. And so it's really hard to tease out some of these more subtle things,
When
like
is it going to
cycling.
happen?
Yes, yes.
Um, One other thing, when I was writing the questions, I thought about this, and the first thought that came to my mind when I thought of the question was, the viewers are gonna love this, and the listeners. Uh, Ozempic. Is it a
Yes.
yeah, yeah. I just have to go there. This is such a hot topic. I cannot afford to lose it. So Ozempic, is it a miracle or just a hormonal disaster in disguise? Because everyone's so obsessed with weight loss, as they always were. Everybody's obsessed with weight loss. But what's with the endocrine system and the consequences that people might not be talking about?
Yeah. So it's, in general, I think that GLP-1 receptor agonists like Ozempic and Wegovy, they are paradigm shifting for a subset of the population who really is seeing is having significant metabolic health effects that are associated with having obesity and overweight. These medications are a life changing thing. So I don't want to discount any of that. I would say there are a lot of people taking these medications right now, though, who don't meet that description, who are taking them for lots of other reasons, including much more modest weight loss than the type of weight loss that I was talking about a moment ago. In that case, I think there's a couple things we don't fully understand. GLP-1 is a hormone, and it's related to glucose metabolism, which is why these medicines were originally developed to treat diabetes. Mm-hmm. And so I think that, there are effects and there are ways these medicines are working that we don't fully understand. But I also think there is absolutely 100% significant abuse going on with these medicines. And what we do know is that when women are consuming too few calories, have too little fat, their hypothalamus and pituitary gland turn off their reproductive system. And so and it's called hypothalamic amenorrhea. Amenorrhea means your period is absent. And it can have really significant impacts for bone. It can have really significant impacts for long-term health and fertility. And so I think that particularly younger women who are, looking to lose, a modest amount of weight, I would be very, very cautious. And I think that some of the interaction with some of these medicines with disordered eating is really concerning. And I think that there's a lot of people out there prescribing these medicines without a lot of oversight. And that does concern me.
Now I'd like to go to the woman behind the expert, that is Jillian. So you talk a lot about hormone craziness after having kids.
Yeah.
You have three,
4.
four, even better. What is one hormonal in all this madness and chaos that it must have been from time to time? What is one hormonal twist in your own life that, in a
Mm.
way, still surprises you, even as a doctor?
Mm. I mean, I think that the biggest thing for me was that I wasn't expecting to feel, and I talk about this a lot. One of the things that started me, really getting more into hormone therapy and thinking about all of this is I didn't expect to have symptoms so early. So I had my last child when I was almost 39, and I was like, my 40s are going to be great. I'm not going to have little babies anymore. They're going to be older. My career's established. I could not care less what anybody thinks about me. And I like sauntered into this, like, I always call it my midlife nirvana. It was going to be amazing. And then like I was 41 or 42 and I started getting these horrible hormonal headaches. And it just really took me by surprise. And it took me a while to even figure out what it was. And I have lot of education on these topics and I was still struggling. So
How did you solve it?
I collected some data on myself. I started tracking things, paying attention to when it was, and then I realized it was absolutely cycle related. And then I was able to have a conversation with a friend who is a neurologist and sort that out. So, but it took some time.
Yeah, headaches can be, I don't know, very mysterious, to say at
Yes.
least.
Yes.
I mean, you're raising 4 kids,
Yes.
writing a book,
Yes.
running a practice. What is
Yes.
your red flag, like the moment your body says, Jillian, you are pushing too far, take a break?
Mm-hmm. So I would say the biggest thing for me is really related to my mood.
Mm.
That for me is the biggest thing. I find that I get more irritable. I'm not all that fun to be around. um so yeah.
I'm trying to start this new tradition. I see a lot of podcasts do this, so I'll try to start a new tradition on this podcast,
I like that.
and ask my guests as the final question: if you can access in a weird, mysterious way the bathroom mirror of everyone in the world, you have only one sentence to write down for them to see. What would it be?
You are your own best advocate.
I like that. This one hit hard. Yes, very good. Very good. I'm happy. Jillian, thank you. Thank you for translating the science, breaking some myths, and not just any myths, I mean, important myths, and reminding us all how women feel is not just, data and not just drama. This episode was like a hormone decoder ring for women who've been maybe ignored, misdiagnosed, or just left in the dark by themselves. As I always like to say, and as you said, be your best advocate and pull up some research, take a read, be your own best advocate. Guys, you can subscribe to Jillian's newsletter, Hot Flash, by clicking. I like how that sounds. Hot Flash, by clicking the link in the description, as well as her website where you can find all the other useful info. Jillian's book is upcoming. The Hormone Loop drops soon, so keep an eye out. If this hit harder than a PMS on a Monday, send it to your group chat immediately. Thank you for listening, and I'll see you all in the next.
If you like what we do here, please consider subscribing to the Neola Effect. Hit the like button. It really helps the channel and me to continue doing what we do. Thank you for listening.